I'm glad you brought up the supply issue. You have in the past talked about this as being a demand-driven problem, but I wanted to ask you, given the incredible abundance of these seizures, both in terms of precursor chemicals and fentanyl pills and powder being seized at the border, and the cheap price that we're hearing about, fentanyl pills being sold on U.S. streets for as little as $4. Is it possible for an abundance of supply to drive demand, to create demand?
Well, regrettably, Nick, we've seen a demand for illegal drugs in this country for decades. And when we have a challenge such as the pandemic, which causes so many mental health issues, depression and the like, unfortunately, we see people turn to controlled substances, to illegal drugs as what they think is a balm, but is only an aggravating force in their lives. You couple that with what you've correctly identified as the cheap cost of fentanyl, as well as the strength of its poison, its toxicity, and we have the tragic results that we have seen in this country with over 107,000 overdose deaths last year, and more than 60% of those attributable to fentanyl. But what we are doing here in the Department of Homeland Security with our federal, state, and local tribal territorial partners is also attacking the supply. It is not just a demand issue. It is not just a supply issue. It is all of the above. And we are attacking the supply not only in the interior of the United States, not only at our border, but in the countries of origin, in Mexico, working increasingly with law enforcement in Mexico, by land, by sea, by air. We're attacking it with all our forces, all our tremendous capabilities, thanks to the incredible personnel that we have.